New at 6, a rare disease carried by ticks found in Lake County using the state health department's tick surveillance program. It's the first of its kind found here, and it could cause serious illness. And joining us now to talk more about this is Dr. Samir Vora, the director of the Illinois Department of Public Health. Doctor, welcome and thank you for being here. First of all, let's start with the basics. What exactly is this disease and how rare is it?
So what this disease is it's a series of rare diseases caused by several related types of bacteria transmitted by tick bites. And in this case, we're alerting the public of the discovery of Ehrlichia murus euclarensis, or EME, in Illinois. As indicated by the name, it was discovered in Eau Claire County, Wisconsin, by a resident there in 2009. At the moment, the only human cases of EME have occurred in Wisconsin and Minnesota, and there haven't been any human cases identified in Illinois to date.
Okay,
so rare, but we're happy to have discovered it so we can inform the public.
I guess there's some comfort in that it wasn't found in a person here. What exactly are the symptoms that you would be looking out for? And I guess untreated, it can be very serious.
Yeah. You know, part of it, most people think of tick bites, they think of Lyme disease. But EME presents slightly differently. Lyme disease is characterized by a red expanding rash that usually appears near the site of the tick bite. The EME rashes are more general and can appear as tiny pin-sized spots or flat red rashes. Most of the time, the people just present with kind of typical fever, body rash, a little bit of muscle aches, and it's really important for you to identify this early. So if you're somebody out in the woods, traveling, a hunter, to make sure you do your tick checks quite often. And this is something that can be treated very successfully by antibiotics, but the quicker we find out, the better, because there is that risk for more severe disease, including things that can cause neurological brain type symptoms that can cause you to be really sick if not treated.
Yeah, I was going to ask you how you treat it and when do you seek medical help? It sounds like right away. Do you suspect now that this has been discovered in Lake County, since it's been so rare, that it is in other counties as well?
Well, I think we are concerned about this, knowing that it's been in Wisconsin and Minnesota, and now in a tick found in Lake County, that people in the northern part of the state should be more alert and aware. And that's the biggest thing for us, knowing that we've had a little bit of a warmer season, important to fight the bite, prevent those things by being aware, doing tick checks, wearing sort of longer sleeve material that we know we will do as the weather cools. But really, as you have those symptoms, to make sure you see your provider, inform them that you've been out in the woods and could be exposed to tick bites, so we can get you treated, and making sure that there are no long-term effects for anybody who happens to have been bit by the tick-carrying EME.
I guess we'll finish here. This really shows how important this surveillance program is. Briefly, can you tell us how that works?
So we're very fortunate in the importance of having this statewide surveillance system, and the Illinois Department of Public Health, and the many things that we have been prioritizing during the governor's leadership of preparing for future emergencies. This is in that bucket. So working with and providing grants to local health departments so that we can identify ticks. This is the second major discovery in the past year, knowing that we're creating a system that allows us to identify things that cause disease, work to educate the public, and making sure that we're working with our providers to notify them and make sure that they know the right treatments to keep our residents across Illinois safe.
Dr. Samir Vora with the Illinois Department of Public Health. We appreciate the heads up. Thank you very much.
Thanks so much for having me.
Okay.